Benign prostatic hyperplasia, or what we would call lower urinary tract symptoms, occur for men as they age, and that's due to the prostate growing. Every year that a man ages, their prostate grows, and as the prostate grows, it impinges on the urethra, and that can create bothersome urinary symptoms for men as they get older. For many men, we start by using medications or behavioral techniques, but once those techniques or medications stop working, we move on to consider procedures for those patients. A very common procedure that's performed is called UroLift. And the way that it works, it's a small camera that goes into the urethra, and there are sutures that are placed, stitches that go into that prostate tissue and pull it out of the way of the urethra. It is a minimally invasive procedure, meaning there's no cutting, there's no incisions, there's no resection into the prostate. So the side effect profile is very good. There's a very low complication rate. Additionally, it can be done for patients without the need for general anesthesia or a hospital stay. Men that really can benefit from that procedure are men that have a prostate that's under 80 grams in size, which is an average size prostate, and without any prostate tissue that's growing into the urethra. Into the bladder, I'm sorry. So one of the other areas that a lot of people will find a benefit to UroLift is that there's no risk during the procedure to erectile function, and it can also preserve the ability for a man to be able to ejaculate, which is not always the case with some of the other BPH procedures. An ideal candidate for UroLift is really somebody that has a prostate that meets those metrics of being under 80 grams, it's not growing into the bladder, somebody that's interested in preserving sexual function, and somebody that's really looking for a management option that is not going to require a hospital stay or general anesthesia. It can work very well for them. Complications that can be associated with UroLift is bleeding. There's always the risk of infection anytime that we do a procedure. And there's going to be some men that don't see a significant benefit from UroLift. And there is a percentage of men that will need a repeat procedure after UroLift if their BPH symptoms recur down the road.